Health officials in Pakwach district have confirmed the outbreak of highly infectious eye disease in the district. The authorities say close to 97 individuals are seeking medical assistance daily, presenting symptoms of the disease. Pakwach district health officer Dr. Paul Ajal confirmed an outbreak of viral conjunctivitis, commonly known as red eye disease. He says since the beginning of this month, the district has continued to register causes of red eye diseases across various communities, including several schools. According to Ajal, the district health office has imposed restrictions on close contacts with the infected persons.
To avoid contact with anyone who you suspect to have the red eyes, you see the eyes are not okay, you avoid contact. And we also request anyone who has a problem with the eye, itching, redness of the eyes, pain in the eyes, to avoid coming to contact with other people and then seek medical care. We also advise that we go back to this old ways of not shaking hands, because it is through shaking hands that many of the people come into contact with this. You shake hands with someone who already had. Remember, someone who has this infection of the eye keeps touching the eyes because has to clean the eyes, has to mop the eyes. So the hand of such a person is highly contaminated with the virus which causes this eye disease.
Dr. Jal warns the public against self-medication and traditional remedies. Instead, calls for prompt medical attention, adherence to personal hygiene practices.
Treatment for this eye condition, eye infection, conjunctivitis, or red eye. Now, red eye is self-limiting. When I say self-limiting, it literally means that even without any treatment, it will heal. The body will contain it and it heals. And usually it takes between 2 days to 5 days. The majority of the people, between 2 days to 5 days, they'll have got better, even without treatment.
Meanwhile, in an interview with some of the patients who are admitted at Pakwach Center 4, they said that the outbreak of this viral conjunctivitis has affected their sights negatively. They added that despite getting medications, no improvement.
Ishakone wang nyamu dano do pe ni tako keluturu do pe ni tako boga do pe tanwang na wang abatata di
to manya no wang achako no ange achako ni ma yela mai no ango charo kuyu ki wen en yo ni ka igine ga me eketi kumu wen no ang wen manyo peka so wanga sama sa do nga sama vutu by sawa a bear mi diwora kama chako no wanga chako pong ka chomo me wanga dengo baka me dong yab wanga de be tek dong ko be tek ira bitu.
However, Robert Umitostin, Pakwach district chairperson, says last week nearly 40 pupils from Pajubi Primary School in Pakwach Town Council tested positive for viral conjunctivitis. He expresses concern over underreporting of the suspects within the community. Omito urged communities to report any related cases of conjunctivitis to health experts for actions.
Red eye, it was very scary in the beginning, but now the management, the transfer is also reducing. The spread from one person to another is reducing because of the approaches that we are undertaking very fast to spread the message, the gospel. Now people should protect themselves to prevent contracting the disease. And at this particular juncture, we are also on the curative part of it, guiding people on what they need to take, what they don't need to take, what they need to do, and what they don't need to do.
Signs and symptoms of red eye include eyelid discharge, teary eyes, sense of grittiness, light sensitivity, and visual discomfort. To date, over 7,600 cases of red eye disease have been confirmed in the country. Alfred Jawok, West Nile TV, Nilecast.